Welcome to my channel. Today I am going to talk about the topic shock. Shock is actually a medical emergency in which two things that can happen. The first is your body is not getting enough blood due to any reason, like your heart is not pumping enough blood to your body. The next thing that can happen in the condition of shock is that too much blood is lost through your body, like in hemorrhage, bleeding, or any other trauma. Now I will talk about the pathophysiology of the shock. We have discussed before that in the condition of shock, two things can happen. The first is your body is not getting enough blood. The second is too much blood is lost. Now I will talk about the pathophysiology of the shock. That is what happens in your body if the blood is lost. First of all, your cells are not receiving enough blood due to bleeding or hemorrhage or any other condition. If cells are not receiving enough blood, cells will not receive enough oxygen because blood carries oxygen to the cells, and condition of hypoxia will occur if insufficient oxygen is present in cells. Anaerobic respiration occur, and as a result of anaerobic respiration, low ATP is produced and too much lactic acid produced. If condition of hypoxia occurs for a long time, lactic acid accumulates in your body and your body ultimately goes toward the metabolic acidosis. And if condition of hypoxia persists for a long time, cells death can occur, and it ultimately leads to tissue death and organ death. Now I will move towards the causes and features of the shock. There are different causes and features of the shock depending on the type of the shock, which could be hypovolemic shock, cardiogenic shock, or neurogenic shock. But there are some similar features of the shock which are present in every type of the shock. These features are hypoperfusion, which means cells are not properly perfused with the blood, oxygen, and nutrients. Hypercoagulability means more blood clotting. More blood clots are formed in the condition of the shock because blood is lost, and blood clots are formed to conserve the blood. Activation of the inflammatory response. We have discussed before that in the condition of hypoxia, cell death occur, and at the site of the cell death, inflammatory response is activate. Now I will talk about the stages of the shock. There are three stages of the shock: stage 1, stage 2, and stage 3. I will compare one by one to make it easy for the use. Stage 1 is a non-progressive stage, stage 2 is a progressive stage, and stage 3 is an irreversible stage of the shock. Stage 1 is called non-progressive stage because compensatory mechanisms are activated and in the stage 1, and shock condition will not progress towards stage 2 and stage 3. It is corrected at the stage 1. Through the activation of these compensatory mechanism, vital signs are normalized, cardiac output is improved, and blood volume of the patient is restored, and patient life is saved at the stage 1. Now move towards the stage 2. At the stage 2, compensatory mechanisms which are activated in the stage 1 are filled, and it will progress towards stage 3. Inflammatory and immune responses are activated in the stage 2. Stage 3 is an irreversible stage, and severe tissue injury occurs, and multiple organs are now involved in the condition of the shock, and multiple organ system dysfunction syndrome occurs in the stage 3. Previously, I have talked about the compensatory mechanism in stage 1 of the shock. Now, I will move towards the detail of the compensatory mechanism, how these compensatory mechanism work. The main role of the compensatory mechanism is to maintain the cardiovascular function and increase the volume of the blood in condition of shock. First, I will talk about the cardiovascular function. How is it maintained by the compensatory mechanism? I have told you that in the condition of shock, volume of the blood becomes low, and this low blood volume causes blood pressure in your body low, and this low blood pressure is detected by the baroreceptors. Baroreceptors are the special type of the pressure sensors present in your body. They are specially located in the carotid sinuses and in the aortic arch. They sense the low blood pressure and send signals to the sympathetic nervous system. Sympathetic nervous system then acts on the heart and blood vessels to increase the blood pressure. In response to the sympathetic nervous system, heart beats faster, and contractility of the heart is increased. Blood vessels contract more strongly. Both heart and the blood vessels together helps in increasing the blood pressure. And now look at the blood volume, how it is maintained by the compensatory mechanism. In the condition of the shock, volume of blood become low, and two things can happen: thirst and renal blood flow also decreases. Thirst is detected by the hypothalamus. Hypothalamus then acts on the posterior pituitary and stimulates the posterior pituitary gland to increase the ADH, antidiuretic hormone. Antidiuretic hormone then acts on the kidney and increases the reabsorption of the water in renal tubules. When the blood flow to the kidney is decreases, then ROS system is activated, which is also known as renin angiotensin aldosterone system. And in response to this, more aldosterone is released. Aldosterone increases the reabsorption of sodium. Antidiuretic hormone increases the reabsorption of water, and aldosterone increases the reabsorption of sodium. In this way, more water and more sodium are retained in the body, and the urine output is low, and in the volume of the blood is also increased.